In this video from Healthcare Management Solutions, we're discussing the Adult Social Care Infection Control Fund. It's worth £600 million from the government, and it's very important to the social care sector. The general public won't know a lot about it, but two people on this video who do are Tony Stein, who's the Chief Executive of Healthcare Management Solutions, and Monica Matcheng, who's a partner at Bevan Britton Solicitors, which specialises in health and social care. Monica, let's start with you. Let's understand what this fund is, what's it designed for, how is it supposed to help?
So the Infection Control Fund was a fund announced by the government on the 13th of May. And the purpose of the fund is to support care home operators and social care operators to manage infection control within their care settings. It has got specific things that it can be used for and quite prescriptive. And it is intended to be accessed by care operators as quickly as possible within the timescales that were set by the government.
Okay, let's talk to Tony then and find out what they think of it. So, Tony, you're running scores of care homes around the country, thousands of residents, thousands of staff. First of all, in principle, what do you think of the fund? And then let's talk about it in practice. In principle, what do you think?
Morning, Graham. Morning, Monica. The principle of the fund is positive. At the end of the day, infection control is a major issue for us, and along with that comes additional cost. And so for the government to step in and to put funds behind how we manage that process is positive. I think I'm speaking for a lot of operators here when I say that any additional money at this particular juncture for the social care sector is a good thing. It comes behind two previous government contributions to social care of 1.6 billion. So there was a COVID financial assistance fund set up, and that came out in two tranches of 1.6 billion. The issue, I think, for a lot of operators when the 600 million infection control fund was announced was if everybody's had the same experience that we've had, is that the distribution of the previous funds was through the local authorities. And unlike the Infection Control Fund, the government was not particularly prescriptive in how that was to be distributed. And all the local authorities chose in their own way to look at how they distributed it in a different way. The upshot of that meant that actually it's quite administratively difficult and very burdensome for operators to access the funding that the government previously gave out. And so when the government announced the 600 million and they said that it would be distributed according to the number of registered beds that the operator had, I think the operators immediately thought, wow, that's great. The local authorities are just going to have to pass through this money and we can tick it off as effectively easier to access funds. The reality is very, very different to that.
So what kind of thing do you want to spend the money on, and what kind of difficulties are you having doing that?
Well, that's not I don't think that's how I would describe it, Graham. I think we're told what we can spend it on. So, for example, we can spend it on topping up sick pay to full pay for people isolating, and the purpose for that is to prevent people for economic reasons attending work when they're ill, and that should stop the spread of infection. And so from the 13th of May, we're now funded so that we can pay our staff full pay if they're having to isolate as a result of COVID-19. Very positive. We're also allowed to, for example, spend the money on recruitment so that we have more staff so that we can then segregate the home into cohorts to stop people having to travel the whole of the home, which obviously contributes again to reducing infection. I mean, we're choosing to spend the money on things like we're allowed to spend the money on bicycles so that our staff don't have to travel to work on public transport. And so we're making contributions to our staff to buy bicycles, pay for taxis. We're actually buying gazebos so that when we're allowed to let visitors into the home, we can do that outside in a comfortable environment So that makes it easier for us to control infection from outside during visiting when that starts to become more possible.
All right, let's go back to Monica. Monica, you obviously deal with other care home providers. You've heard a long list of creative and innovative things that Tony is wanting and enabled to spend the money on. Are other care home providers meeting any difficulties with this money, or is it actually doing the job?
I think most operators are probably experiencing some of the frustration that Tony has expressed, which is that there is the announcement of the fund was really welcomed by the sector, but I think that there are some local authorities who are approaching this in such a bureaucratic fashion that it's actually making access to the fund quite difficult for a number of operators. So you have got some local authorities who are looking to require, ask unreasonable requirements of operators as part and parcel of accessing the fund. So, for example, we have an aware of one local authority who has continued to ask operators to accept COVID positive, possibly COVID positive residents without those residents being tested. We've got some local authorities that are seeking to get operators to sign quite lengthy grant funding agreements.
So the local authorities are trying to gold plate the fund to get deals that will suit the local authority going forward. Are you able to challenge it?
You are able to challenge it, and we do get where the local authorities are coming from in some respects, and that is because the way that the fund has also been set up, with the government putting some of the risk and onus of whether or not that funding falls within state aid rules on the local authorities. So you have got some local authorities who are taking an overly cautious view and route of how they approach the grant. So I think it's understandable, but I think the intention of the grant was to get the money to operators as quickly as possible. But I think some of the measures that come with the funding just means that those timescales start to look more and more unrealistic for lots of operators and also local authorities.
And Tony, you operate homes both for yourself and for companies that you're contracted to. What is your advice to operators about how to make this fund work effectively?
I think my advice would simply be accept that this fund is for infection control. It's not a general purpose fund. That was the previous funds. So make sure that you're on the NHS capacity tracker, fill in the forms, get them in on time, and try and make certainly the initial forms that you fill in as comprehensive as possible, so that you have less difficulty later on down the track.